Welcome back to the Veterinary Telemedicine Facebook Community YouTube channel. I haven't done an interview for a while because we've been super busy with the Vivica conference and getting all sorts of stuff off the ground, but I could not resist the opportunity to talk to one of my favorite people in the world, Dr. Cherie Buisson, who is a hospice and palliative care veterinarian in Florida. We actually met through IAA HBC, which for those of you who don't know, it's an organization of palliative care veterinarians. And so in addition to her work in hospice, she is the founder of A Happy Vet, which is all about wellness and taking care of yourself. It could not be more relevant right now.
Or more badly done by the founder, I might add.
I think that's the case for all of us, right? So we are going to be talking about not only how to use telehealth and virtual care with your hospice and palliative care patients, but also how you can use these tools to set boundaries a little bit better. So thank you for coming on.
Oh, thanks for having me. It's always fun to talk to you, and certainly with all this isolation, it's been good to talk to friends and see their faces since I'm spending a lot of time alone lately, and that's not necessarily a good thing.
Yeah, well, I mean, I'm an introvert, and I'm like, okay, I'm good. Like, I'm ready.
Mm-hmm. Yeah.
Even I am a little worn out of 7 months of staring at nothing. So
yeah, I could totally people right now. Not everyone, but yeah, I could definitely use a little time with someone besides myself and my immediate family. Although I love them and thank God we like each other, but I'm ready to be done with this mess, and I don't see an end in sight.
No, we all need a little balance.
Mm-hmm.
And it's funny because I feel like we're reaching that 6-month point where our reserves are totally drained. And so all of the things that I was working on and making good progress, like, I'm setting boundaries and saying no, like I don't even have the energy for that kind of stuff anymore. And it was interesting when you were talking in the group about how you've been using these quality of life assessments, because I know, like, for me at this point, I know what I should be doing. I know that I should be saying no. And I just, it takes more emotional energy to say no than to just do it,
Yeah.
And I think,
or you think at the time, and then you get to it and you're like, why did I agree to this?
Yes.
Why?
No, it's like either way, you're dealing with like all of this like seething anger and resentment. And so I'm always on the lookout for someone to run interception for me, whether it's another human being or technology, like, great. I would love to have some sort of barrier between me and this person who's imposing on my space.
Mm-hmm.
I put a flow chart up on my website. Worked really
I love the flow chart. I've shared that a bunch of times. I love it.
It worked a little too well, but yeah, I basically set up this flow chart saying, do not email me unless like all of these conditions are met. It was great. So how can we use, or how are you using telehealth with your palliative care patients? So let's start with that, because I feel like that's one of those things where, boy, talk about a time suck, and you want to help,
mm-hmm.
but you also 3 hours, so tell me a little bit more about that.
So when I started my practice, like most of us do who start an end-of-life care practice, I answered my own phones, just because that's what you do. Because when you only get 2 calls a week, it doesn't behoove you to hire somebody to answer those 2 calls a week. So I answered my own phones, and in order to get clients, I didn't have anything else to do. I would sit and talk to them for an hour about their pet and, give them advice within my boundaries of the vet client patient relationship. But, you can give at end of life care, have you heard about paw friction that you can put on their feet? Or, have you heard about this? Can you raise their food dish so they don't have to bend so low? So things like that, I could walk through, and I could talk to them about what medicines their vet had prescribed and what each one does, and, the trajectory of their disease. So there was a lot to talk about. And when I got to where I was like, well, I really want to be able to do this and charge a fee for it and make it a service. That's hard when you answer the phone because there's no buffer there. So it's like, hi, yes, you're talking to me right now, except that I'm not going to do that unless you pay me for like longer than 10 minutes, and it was awkward and uncomfortable for me. So when all of this COVID stuff hit, I quit doing hospice care. I quit taking on new hospice clients because I do a very high touch, high level of kind of concierge. My clients have access to me from 8 a.m. to 8 p.m. And before everybody gets all freaked out, I have like 10. It's not like a practice of 500 people. I usually keep about 10 hospice patients at a time. And so I quit doing that because I didn't want to be in people's houses for that length of time, because I usually spend 2 to 3 hours with a family for my hospice fee. And I was like, I just can't, with the prescriptions coming in, and suddenly our call volume tripled. And I was like, I can't do all this myself. So I had already brought on an assistant and another vet to help me doing relief. And then I had to hire somebody to answer phones. We started at 2 days a week, which was like, boy, I got that. And within a week, I was like, okay, what can I do for the other 5 days? Because I don't ever want to answer my phone again. So we started doing this virtual chat, because I would get people that would say, we don't want a hospice consultation. We just want you to meet us and our pet before you euthanize our pet, so we feel like we know you. And, I was like, no, because what we're going to do is I'm going to come over and see what kind of shape your pet is in, and then you're not going to let me help. And then I'm going to go home feeling like crap. And it's just not going to be worth it for either one of us. So, people always wanted that. And I was always like, no, we don't do quality of life assessments. You either have me out to do hospice care on your pet, or we don't do it at all. And, that was a boundary that was really hard to draw. But every time I went back on that boundary, it just went badly. I'd end up spending 3 hours at the person's house, and they would still not end up letting me help their pet. And I'd go home feeling terrible. So when all this came up, I thought, well, we'll do virtual quality of life consults. I'll basically do on Zoom what I am doing on the phone for free, and give them an hour and review their vet records. And I mean, the number of people who wanted me to like review their vet records and go over meds with them, but didn't want to pay for it, was just astounding. And I was like, I need to stop doing this. So we implemented this, and it was great. And as I was doing it, I was like, wow, this is basically the meet and greet that people want. And I would tell them, like, the reason we don't do a meet and greet is we have 2 doctors, and the odds of me being the doctor who comes to you after the meet and greet are pretty slim. We don't know what doctor's going to be there on the day unless you plan like a week ahead. And so, I didn't want people to be disappointed or upset because they didn't get the doctor that they had the virtual consult with. So I always explain that out. We can't diagnose, we can't prescribe, because I've never met you or your pet, but we can talk through things. And I can tell you that it may not be me. 50% of the time it'll be me, 50% of the time it'll be my other doctor. And people were really responsive. And I learned that I could do so much. Like I can't auscultate, I can't palpate the abdomen, but man, could I evaluate dyspnea for people? I'm like, oh no, your dog is in bad shape. Like this needs to stop ASAP. In fact, I had 2 on Sunday that were both like dyspneic. And I was like, you guys need to schedule sooner rather than later. This pet's in distress. And we euthanized both of them that week. The people were super grateful, and they felt like, they both told us they got their money's worth out of it. Cause I felt kind of bad. I'm like, here's your quality of life evaluation. It's bad. We need to euthanize your pet. And I was like, oh God, that's not what I meant to do.
Like how valuable is that to them? Right. Because like when you call your vet, and you're thinking to yourself, you're in the clinic, like things are stacked up. Like I do not have 2 hours. So you get on, you're like, yeah, okay, whatever, come in. Or you send them the little stupid piece of paper. Like there is no opportunity for them. And for you to offer that, like that quickly, and be like, yes, that's bad. Like that's what they need. Like that's huge.
Yeah. And they would say, oh, but he's so, he greets us at the door and he's so happy. And I can see that he's happy, but I want you to look at his face. Do you see how he's furrowed right here in his brow? He's worried. Do you see how his eyes are bulging a little bit? That's not normal. That's him being distressed that he's breathing like this, and he's trying to look as good as he can. And I was worried, technology with people, and I live in Florida. We have a huge elderly population. And I was like, is this going to be okay? Man, people whip out those cell phones, and I'm like, all right, get on your dog's side. I want to see his whole body. I want you to get closer. Okay, stop. Don't move the thing. I'm just going to watch him breathe for a minute. And they're quiet, and they let me do, and, lift his lip. Let me look at his gum color, push on his gums. Let me see his capillary refill time. And I was like, this is a terrific tool. And then I had a lady that contacted me for a virtual quality of life, and her dog wasn't
that bad off. He was just horribly arthritic. And he had a cough. The vet had put him on prednisone, and she said the dog, she would pick him up and he'd just pee. It was just awful. And then she didn't give, they had prescribed pred and then prescribed Rimadyl to use later. And she had never done it because she thought they were the same type of thing and it was going to make the dog pee. So I talked her through, and, the vet had already prescribed this medication. I wasn't prescribing it. I was just saying, you should really give the medicines your vet prescribed, which I think that's pretty reasonable. And as we went along, I said, look, I'm not taking new hospice clients technically. I said, but, your dog looks like he could really benefit from this. If you were willing, since we've already done this, this is basically the history that I do for hospice patients. I said, I'll just come over to the house, do a quick 5-minute exam. We'll all wear masks, and then I'll leave, do all my prescriptions in the car, and then I can take over, his care if that's what you want to do. And she didn't take me up on it, but the dog did so well on Rimadyl. She's out, taking the dog for walks, and the dog's, running around. She's sending me videos. And so I didn't get the full benefit of a hospice appointment out of it, but I got paid for my time, and this client is keeping in touch with me. And I just feel like everybody won, she won, the dog won, and I won. And like, what more could you ask for? And so I realized, I was like, well, if I do this and tell them, within a week, if you schedule a hospice consultation, we'll take the virtual consult price off, because I would have done that anyway as part of the consult. Then, they feel like they've actually gotten a discount when they haven't.
And so it's interesting to me, because I was talking with someone else earlier today in the careers group who was saying that this happens to us all the time, because somebody calls and they want to talk to you. Mm-hmm. And we just do it, because once you get on the phone, there's no way to sort of get out of it. And one of the things that people keep saying over and over is, well, we do it because we have to. Like, the clients expect that you're going to do it for free. And
because we train them that way.
Yeah. Like, have you ever asked them? Like, we don't ask them. We just assume the answer is going to be no. So what percentage do you say? Because obviously some people will say, oh, no, I don't want to do that. You're like, I don't want to have this consult.
Well, it's hard to say, because most people that call me they know that they want
euthanasia. So I would say probably the people who aren't sure, maybe 25% of them. And we're not pushing it real hard. We just mention it. You can do this or you can do that. And that is something I probably need to talk to my team about, is how we're wording it and how we're talking about it. But I think either we're having a conversion either way. Either we're getting the quality of life consultation, or they're scheduling a euthanasia. So it seems to be working out pretty well. And I even have people who are like, I want to do a virtual quality of life consult in 2 weeks. My cat's not that bad off, but I want to schedule this and get it on the books because I'm concerned. And it's like, well, okay, that's
brilliant. Yay. People are
schedule ahead.
But I think what's interesting is this idea that people have in their head that so many people will say no. Like, you will lose so many clients by asking them to pay, that these people who demand free stuff are going to all storm off.
Where are they going to go?
Yeah, where are they going to go? And like, so the person who's been like, it does not value you or your time or your opinion leaves. Like, that still seems like a win. If your problem is you're so busy that you're staying 3 hours late, like, don't you want to get rid of the people who won't pay you before you get rid of the good clients? Like, because your good client is waiting in the parking lot for 45 minutes while you're dealing with this non-paying person, and then they're going to leave too.
Right. Right. Yeah, exactly. And it doesn't even have to be, me. I mean, a certified veterinary technician could have looked at that dog and said, I don't like the way she's breathing. They're trained to triage. So they should be triaging. And if they say, well, you're not sure if you need an appointment, why don't we do a little virtual consult? Let me take a look. And then, we can talk about what's going on, and then we'll make a plan for what to do. And even that, I mean, the things that I see on here, the way the pet is walking, or they're like, oh yeah, his arthritis is really bad, but what he's doing is walking in circles with a head tilt.
Yeah.
Oh yeah, that's not arthritis. And now I know you need to get in here right now. We don't need to send Rimadyl home with you. We need to get you in to see what's going on. So it's so valuable. And I kind of even was like, nobody's going to want to pay for this. And I have not had anybody say, oh,
That's a waste.
yeah. And I mean, and I'm charging to sit with them for 45 minutes to an hour. Because if you can't tell already, I talk too much. So yeah, I tried a half an hour and I was like, I can't, there's no way. 45 minutes to an hour.
It just takes me half an hour to warm up.
Yeah. Like I'm just meeting you and telling you how cute your dog is. And that's 15 minutes right there. So so that to use it for all members of the team to let your team, especially with us being so crammed in with COVID and everybody's so busy, to know who needs to be seen and who doesn't, who's doing, you look on the thing and the dog, you can't even get a good camera view on the dog because he's jumping around and acting like a lunatic. That dog can probably wait, the one that's gasping for air needs to come in. And it's great that you can tell this stuff before they get in your parking lot and wait for 45 minutes.
Yeah. I had a friend text me. And so I don't usually like encourage this, but this friend is a doctor. And so we have this agreement. Like you can text me about your dog and I will text you about my kid, and we exchange teletriage. Like this is our arrangement. So she was asking me for some triage help. She's a great owner. She will do whatever it takes. And her dog was acting a little weird, couldn't get her in for 2 weeks. And so she calls the ER and it was a 6 to 8 hour wait.
Mm-hmm.
And it was like literally 100 degrees out. She's like, I will do it, but do I have how necessary is this? And I get it. Like the ER staff doesn't have the energy to do that over the phone, and people don't know that you can call triage services, but staffs did, like, for whatever reason, like, are really underutilizing their technicians. They had Liz Houston on and she's like, hey, we're here. Like, please, I will help you already. Yeah, I know how to do that.
And an ER, I mean, I think every ER in the country right now could benefit from having a team
of certified techs who, like, people call in and they're like, okay, let's set you up. We're going to take a look at your dog via the phone and the camera and see whether you need to come in and wait 6 hours or whether you can wait and see your vet. And I think that would make so much of a difference. And I mean, yes, there's expense and there's all kinds of things involved with it. But if you learn how to leverage technology and to leverage your people, and if you have people who maybe sit around and aren't busy when things are quiet, not that things are quiet right now, but I mean, there are things you can do. Or if there are, if you have technicians who can't come in because they have some sort of illness or problem that makes them, it's dangerous for them to come in and be around people. Wouldn't that be a great way to help those people to work from home? And who'd have thought you could do veterinary medicine from home, but they could be invaluable in helping to triage and move things through and make things smoother. I always said if I ever owned my own clinic, my receptionists up front at the front desk would not have phones. They would only help the people who were standing in front of them, and that would be their deal. And I would have people in the back or at home who would answer all of our phones. And no, I did not plan this all out, so I don't know the logistics of how that would work, but I know that it could. And to have it so that you're not doing this while you're talking on the phone to a person who's standing there potentially going to spend hundreds of dollars in order to talk to someone who wants a bunch of stuff for free or who's price shopping. I would want the people in my lobby to be getting the utmost attention because that's where today's pay is going to come from. So, yeah.
I think that's really insightful. I was having a conversation along those lines with Danielle Lambert the other day where we were talking about making curbside easier. And, half the people were trying messaging for curbside and it didn't work because the messaging is not immediate unless you have somebody who's sitting there watching the live chat. Like, you need the phone lines to help your curbside people. But that doesn't mean it's the other people, you need to get them off the phone, right? Because who are they on the phone with while they're doing this? And somebody asking, is my dog due for Bordetella? Why does it matter? You're not boarding them right now.
Yeah. Not till next year do we have to have this discussion right now. And the messaging, is helpful. And yes, you do have to have somebody that's watching it, but, it can be done. I text with clients all the time, and you wouldn't believe how much time it saves me. Plus, we can go back into we use Ring Central, we can go back into our chat history and copy and paste the entire conversation and stick it in the medical record, and use that to keep track of things, because I love things to be in writing. People have very bad memories, including me, and I don't always remember what a client said, or, and I don't have time to type all that out. Whereas if it's text, everything's in writing. We know exactly who said what, and it's all in the record, and it's quick.
Yeah. I mean, don't get me wrong. I love messaging. I think it's probably the most underutilized form of virtual care that we have right now. But I think like you've picked the one thing that you shouldn't use messaging for, like, right? Like the people sitting in the parking lot, like use messaging for everything else so that you can focus on those people. And it seems like when we were talking about triage, I don't know how many clinics, like most of the ones I've dealt with, the CSRs do the triage. And it's just like either I know what to do or I tell you to go to the ER. Like there's really not a lot of people that have clear workflows to route these questions to technicians. And it seems like the texting is a really good intermediary spot for that.
For sure.
So I wanted to also talk about happy vets, because like we need to be happy vets right now.
Oh God, it would be so nice.
I know. So what was the impetus for starting that?
Well, it was mostly to give
myself a brand for my writing and speaking, because I didn't want to combine. Helping Hands is my hospice clientele, and while a lot of them follow me on a happy vet, I didn't want to blend those two together, because in a lot of places as a happy vet, I'm talking to vets about how to say no and how to set boundaries. Yeah. And that can be misunderstood or outright upsetting to clients. So I didn't want to marry those two and chance that, I might feel the need to say something that might offend clients. I wanted that to be separate. And honestly, happy vet is like, that's life goals for me. Like if I could be happy vet, that'd be great. I'm not, like right now, I'm not most of the time, but it's always like, that's what I'm striving for, is that happy, healthy, with a sassy grin and just trying to enjoy vet med. Because I didn't for so long. When I first started, it took me 8 years to find a place where I was happy. And I've moved on from that place to doing, which was relief, to doing hospice care. And, I don't have any relief on my calendar anymore after July. So it's changed. And I love that it changes, that I can, if I'm not happy with something, or it's not fulfilling me, or it's burning me out, that I can just switch and do something else. So I'm doing hospice care and writing and speaking, and, that makes me happy. But it was a reminder too, to make sure that I'm always doing what makes me happy. And if I'm not happy, to change it. If I could magically produce a COVID vaccine, then that would make me happy. But we're going to have to rely on other scientists for that.
Baby steps. But I think the fact that, you're saying I'm a work in progress is what makes it relatable. Like I always, like some things, okay, aspirational, and other things you're just like, oh, just shut up. You're like the person who's perfectly, they've always been happy. Like their life has always been amazing. Like I don't relate. No, I want to talk to the person who just scrape off of the bathroom floor a couple times during COVID, so you feel me.
Yeah. Oh, for sure. And I said this, I was on a podcast with somebody, and I can't remember who, that like a happy vet's my therapy. Like all the speaking and writing, that's me cutting myself open and letting everybody see all my, imperfect insides. And it helps me to heal. Like if I'm teaching people about imposter syndrome, you can bet your butt it's because I've had it, and I do have it, and I fight with it all the time. If I'm talking to you about setting boundaries, it's because I suck at it, and I need to hear myself say that these are the things I need to do. And it does, as I have said it to others, and as I have counseled and coached others, it sinks in, and I do better myself. But I wanted something that showed everyone that I'm definitely not perfect, and that I'm trying really hard to be okay with being imperfect. And that has been relatable to a lot of people. I mean, I suffer from anxiety. I'm a wreck. I mean, not I'm a wreck all the time since COVID started. I don't have this figured out. And I've started lectures with like, if you guys are here because you think I have all my stuff together, I'm really sorry, but you're about to be very disappointed.
because I don't, I can just tell you where I've screwed up and how not to do that. And that I'm really good at. So, I'll tell you what financial mishaps I've had, and there have been many, and relationship mishaps, and there have been many, and, and professional mishaps. So that's, I wish I had had someone like that when I was in vet school to tell me that I didn't have to be perfect and happy and, doing everything and enjoying everything. Cause I just didn't know that so many of my colleagues were unhappy, and we just, we didn't have all this technology to talk to each other because I'm so old.
Okay, I talked about answering machines in I did today. So
I had a beeper at my first job. I had a beeper.
Yeah,
it was it was a thing. So
yes, so it's okay. We're all old here and still don't have it figured out, which I think is, especially now. Veterinarians are such perfectionists to begin with, and so now you're in a situation where pretty much everything around you is out of your control, and we rely so much on that false sense of control. So what would you say? I especially worry about like new grads, right? They're graduating into this completely uncertain world, and they're used to looking at their colleagues who, like, maybe they're lying, but they look like they have it together, and like they're all messed too. Everybody's just, oh my God, like, everything's horrible. So what do you say to somebody who's just like trying to figure out, okay, I know I can't get to Z, but like, how do I get to step D if I'm right here at A? Like, what do I do first?
Yeah, I almost think this is good for new grads, because if you can get through this, you can get through anything. Like,
true. It will never be worse than this.
Oh, did you just say that out loud?
Jessica. Okay. All right. Well, that's it, y'all. 2021 is just screwed. We're done. We'll see you next year this time, and Jessica won't say that ever again.
I may not be here.
I feel like this is, it's a good learning opportunity. I mean, it's rough because everything is so busy, but I feel like the lack of clients in the building is maybe having teams able to talk about things more. I remember getting pulled into my boss's office when I was first a young vet, and I had asked a technician a question about what my boss would do in this situation, and the client overheard me from the room, and they were very upset that I didn't know what I was doing. And my boss was like, just ask the technicians, they know everything. But he forgot to say, don't ask them in a normal voice outside the exam room door. It was just a logistical thing. But that's not a thing as much now, which I think that's going to be a problem when people start coming back in the clinic. Everyone's going to have to remember their indoor voices and what you can and can't say, when there are clients in the building. But I think I know I get overwhelmed trying to do, like, look at the big picture and tackle it. Like, one thing, one thing that you need to tackle is this, and then you can tackle the next thing. I learned that when I was in a car accident a few years ago, and I have concussion syndrome. I have permanent brain damage and never hit my head, but have a concussion. And a pile of laundry would be too much for me to deal with. I would look at the pile of laundry and not know where to start. And I know that sounds ridiculous because I'm a doctor and, I save lives and I can do surgery. But there were days where the pile of laundry would make me like break out into tears. And I just learned that I have to walk past it and grab something. And when I've grabbed it, do what I need to do with it. And then I can do the next thing. And I think the other thing and this is something I've just, been cognizant of learning just recently, is it's not permanent. You don't have to commit to something and then do it forever. So if you want to try doing virtual consults and it's a bust, at least you tried. Okay, so we don't do that anymore. Take it off the website. Like, it's not that big a deal. I mean, you wouldn't believe how many times I have contacted Whisker Cloud and said, I need you to change first it was, I need you to change the consult from 1 hour to 30 minutes. And then it was like, okay, I need you to change it to 45 to 60 minutes because that didn't work. And I need you to change the price, and I need you to increase the price because now we're going to do it for longer because I can't shut up. And I change things all the time. And I think we're so fearful of change because we're afraid to get it wrong. But I think, we need to look at it as we're going to trial this. And I really think this would help teams too, when you go to change something, because we always come in and we're like, here's the deal. We are going to start doing this. And everybody on the team's like, oh no. Because if we came in and said, look, here's what we're going to do. we're going to try this for 30 days. And then we're going to reconvene and see how it works. But I need you all in for 30 days. I know you guys can do this. I think we get so much better response. But instead it's like, we're going to cut your insurance in half forever. Good luck with that. And then we're like, and they were mad. How entitled and rude. And it's like, you just upset everybody's funds like, and freak them all out. Of course they're scared, and I think we're like, it's all or nothing. And there are so few things that are all or nothing. We're going to try this new drug. If we don't like it, we won't buy another bottle. But people are like, oh no, once we try it, we're stuck with it. And I think that's a terrible mentality to be in. Yeah. And now that I've started, I was like, okay, I'm going to hire somebody to answer the phones 2 days a week and just see how that feels. And oh, sure enough, it was fabulous. Let's do some more. Let's try an answering service. Let's hire somebody to do the other 5 days. It's just a matter of getting out of that mindset of permanency and we have to. Like, you can change anything you want. You could go and become an all cats practice tomorrow and make all your dog clients mad. I don't recommend it, but I mean, I do recommend it. I love cats only practices. But I tell my students in lectures that, you can go live under an overpass tonight. You know that, right? Like, you could just say, I'm chucking this whole thing and I'm going to go and live out my life.
It's a really dramatic choice.
It does, but you can. And that's the thing that people don't really, they're like, I'm stuck in this job. Really? I don't think you are, right. And I think that's part of what drives people in our profession to suicide, is that we don't see other options. And it's like, you could just leave all this behind without having to do that. And if you wanted to go, my boss and I used to fantasize about being the greeter at Walmart. Like, I'd love to have a job where nobody cares if I even show up. Like, people can get their own cards
of like what people have chosen as their alternative career, because every single person I've spoken to there's always something.
Oh yeah. It's an awesome icebreaker for people who don't know each other. Like, I would breed aquarium fish. I would have a whole room full of aquariums and do nothing but breed fish and play with my aquariums all day long. And, it cracks me up. But, all of us, I think, go, why do I do this to myself? Well, yeah, we make this choice. And once it becomes your choice instead of something you're stuck at, it makes it a little easier to get through, I think about that every time, my husband and I have an argument. It's like, is it bad enough that I want to pack up all my stuff and leave? Because I can. Yeah. But the answer is usually no. It's like, okay, well, that's kind of dramatic. Maybe I should just go talk to him about his socks and the laundry. And maybe I shouldn't pack my suitcases and my 2 wiener dogs and set off for a hotel somewhere. But we feel stuck and we shouldn't, because we're never, ever truly stuck. It's just, it feels that way because we have,
especially during a lockdown.
Yeah. And even that, like, I was like, go outside and walk the outside of the perimeter of your property. Like, go walk outside. If that's all you're allowed to do that. And we found things to do. We rode our bikes. We went out to the park and took walks. And I know some places were more shut down than others. But it was heartening to see the number of people on bicycles, and you could tell they were new bicyclists. Like, they had no idea what they were doing, but they were like, I need to get out of this house and I need some exercise. And all of a sudden life's a little better.
I will tell you, veterinarians and bicycle shops were the two big winners in the last 6 months. Boats. You can't get your bike tuned now.
Boats in Florida.
Oh, yeah. I'll bet.
The boat and the RVs, because Derek and I even thought, and we are not we don't like driving vacations, but I was like, I got to get out of here. How about, could we do an RV so we don't have to stay in a hotel and we don't have to interact with people? All of those things. And I think I hate to say of anything good coming out of the pandemic, because it really just sucks. But we are learning as a profession to set boundaries and say no. I mean, would you have thought if in January of this year, somebody told you veterinarians will no longer allow clients in the building and they will say no and set boundaries and they will lock their door to prevent people from walking in? I would have been like, yeah, right.
That's a weird dystopian novel you're describing.
Yeah. But we did it because there was enough. I mean, good Lord, it took a pandemic, people. We need to do better. Like, we need to care about ourselves a little more than, okay, well, because of a pandemic, I will
because you might kill me.
Yeah. Only if you might kill me. And even then we're thinking about how we can make
make an exception for certain.
And I'm not saying that I love that clients are locked out of the building. It isn't that, but it took this to make us see that we can do this. Now we all had to do it together. So I'm sure if like half the clinics had closed and half hadn't, we'd be having more problems. But
and that's coming.
Yes, I know.
There's going to be that transition.
I know.
So
and I had to set a boundary there, because when I was doing relief, I told them, I said, if you are going to allow clients in the building, I will not be able to do relief for you anymore. And this was a very good friend of mine. And I felt terrible. And I quit doing relief at all for a little bit there when we were expecting our peak in April and May, I think. I just told her, I'm not coming to work. We're not doing this. And she was, very respectful. And when I came back, like the whole team was wearing masks. They were very good to me. I know that's not the way it was everywhere, but, I think it gave me the courage to say, okay, yeah, this is making me super uncomfortable, and I can't work this way. So.
Yeah. And I think a lot of times, we talk about, I feel bad talking about a silver lining. And, of course, like nobody in my circle is ever going to say like, oh, this is great. Like, I'm so glad the pandemic happened. I mean, that's not how most humans think. But I do think it's a sort of a core component of resilience to say, look, this is horrible. Nobody asked for this. But now that we're here, like, what can we learn from it? Like, what can we do to make things better? Let's at least not exit this situation in the exact same holes we were in before. Mm-hmm. So
absolutely.
If that's all we get out of this, then at least that'll be something.
Mm-hmm. Yeah. And the number of veterinarians that are telling clients they're not welcome if they can't cooperate and be part of the team. That's one of my biggest pet peeves is bosses who force their team to work with abusive people. And that nothing good comes of that. And seeing people say, absolutely not, this is my staff, this is my team, and this is what we are doing. And if you can't get on board, you need to go somewhere else. I think maybe it empowered us a little, and in a time where we have no power and no control, and we all feel like we're spinning wildly into the universe, this gave us, it was like, this I can control. And so this is what we're going to do. And I don't have the bandwidth to put up with this. So here's how it's going to work. And I did the same. I'm going into people's houses and doing end of life care. I have friends in California who are doing all this outside, and now with the fires, that becomes a problem for us.
It's smoke, you COVID, like
there's no good
my
place to do
pressure tent.
Yeah. And so I've been going into people's homes. I take what precautions I can, and we're very strict about masks. Does everyone cooperate? No, but I can control how far I'm standing from that person for 99% of the appointment. And if they give me trouble on the phone,
personal protective.
I have a KN95 mask with a fabric mask over it and goggles that I wear.
Sprays or anything?
Oh, no. Mace?
Yeah.
No. We're all good there. But yeah, I mean, it's not like I'm sitting at home not taking any risk. It's just that it's risk. I'm deciding. I'm making the choice what risks I'm going to take and not take. And I think a lot of people have suffered for saying, I've got chronic illnesses, or I'm caring for someone with chronic illnesses, and I can't be at work if everybody's not going to wear masks, or I can't be at work if you're going to let clients in the building. And it's just really sad that people have to choose between making a living and staying safe in times like this, because, we have so many different ways that people are handling things. But I think, telehealth is a way to start, and to make these things happen. And I'm telling you, because I do it every day, I have a team and we don't see each other. We see each other over Zoom occasionally, but we talk via text. I have somebody who answers my phones that lives 3 miles away. We're doing it, and it can be done. It's just, it feels so big right now because it's like, we can't tackle all of this and being triply busy. But you can. You just have to take tiny bites and like little victories, and each one that gets you somewhere. It's like saying, I'm going to implement low stress handling. No, you're going to do one thing. You're going to put treats in your pockets for the dogs. And when you see how well that works, then you'll move on to the next thing. and keep going as it continues to reward you. So I didn't think I could do this. I never would have thought a virtual visit would go over, but I'm so excited to have this tool at my disposal that I can say, no, you need to do this now, or you know what, this doesn't look so bad. Let's see what we can do to help you out with this.
Do you collect payment at the beginning or at the end?
Of the telehealth appointments,
Yeah.
Yes. I tell them I'm going to send you an invoice.
When the invoice is paid, I will send you a Zoom link.
Ooh, smart.
Yeah. So that's how we do those. And then my home euthanasia appointments, I usually collect at the end of the visit. My associate collects at the beginning. She's like, I don't have the right to give your money away, so I don't want to chance somebody going, haha, we don't, we're not going to pay you. So she's like, I collect at the beginning, and people are fine with it because they're signing paperwork anyway. But yeah, I do that all ahead of time, and that has worked well. Again, I had a qualm. I was like, oh, are people going to think I'm just, greedy and money hungry? No, I send the invoice, and then it says, boom, so-and-so paid your invoice. So it's like, oh, well, isn't that nice? And like I said, I felt like maybe what I gave them wasn't worth it. And they're like, oh, that was so helpful. I'm like, but who gets to sit down with a vet and talk for an hour? Even in a face-to-face in the clinic, they don't get to talk to a vet for an hour.
No.
You get to talk to them for 5 minutes or 10 minutes maybe, and this is so nice that we can just, I can sit and give them my full attention and answer whatever questions. And sometimes I'm like, are you sure you don't have any other questions? Because we've just covered everything so thoroughly, so quickly. And they're like, no, we're good. We're ready. And now we know what we want to do. And that's just great.
It's huge. That's what it's all about.
Mm-hmm.
So thank you so much for
You're
coming
welcome.
and talking. I always love talking with you. If people want to learn more about some of your speaking topics, where should they go?
They can go to ahappyvet.com. That's our webpage. We do have information there. Most of the stuff that I do, like A Happy Vet, really lives on Facebook. We also have an Instagram that I get to when I can. I'm old, so I'm a Facebook user. But I post things, as much as I can on Facebook, and that's anything that I can find to help you guys out, to try to make your lives easier, to make you laugh, to urge you to take care of yourselves and not be so hard on yourselves.
You have amazing memes. I think you like some of the best memes on the internet on your page.
Thank you. And I can't be responsible for any of them, because I do find them elsewhere, and I try to give credit wherever I can, and let people know that their memes are helpful. But yeah, I have a soft spot for a good meme. It just makes me happy.
Well, thank you again. And thank you guys for tuning in. We'll see you next time.
Bye, everyone.